Can you tell the difference, Shellie? Because you've been a pediatric respiratory therapist for a long time. So, I mean, can you tell the difference like before versus now using them and just maybe just talk about the burnout in your field and just maybe how the tappers are helping you?
Yeah. Yeah. So the tappers, the burnout in our field is pretty bad, as you can imagine, because as a respiratory therapist, if you go work with adults, you only have to know basically one set of vitals and a couple ventilators and maybe a BiPAP or something. And I'm not saying that their job's easier because they have their own challenges. But if you work with children, we don't give up on children very easily. So we have tons of equipment, we have tons of things that we do, lots more to remember. And what's okay for vitals for a 2-month-old is not going to be okay vitals for like an 18-year-old, and it might be different for a 12-year-old. So you have to be able to think very, you have to be able to think basically. And if that panic or that anxiety takes over your brain, it shuts down your ability to think. So when you have these tappers going, it's a lot easier to hold that at bay so you can think clearly, you can remember things, you can stay calm, you can stay focused, you can contribute to the team effort. And I do think, because I've noticed that anxiety can be one of the most contagious emotions. So if you have one person on your team that kind of loses it and then it kind of starts to snowball and people kind of start to panic. And it's really easy if you have tappers on and you're the calm one to be like, hey, guys, wait, you got to kind of throw yourself in front of that freight train and be like, whoa, whoa, whoa.
They're
This is
probably
what,
co-regulating off you because you're
yeah.
staying
Like,
calmer.
so it's nice if one person's calm and they can kind of spread their calm because that can happen too.
So you can tell, like when you would, so you're wearing the tappers during your shift and you can tell when they're on versus when they're off. Just tell me a little bit about that.
Yeah. So it's really funny because it's just a constant calm sensation that's kind of going on in your brain. And you, after a while, you kind of, it almost feels like you don't notice it anymore. It's really weird because you're like, oh, you think that you don't notice it, but when it turns off, you know immediately, if that makes sense.
How do
So
you
you're
know?
like,
How do you know when it's off?
it's just weird because you feel different. So you'll be sitting there doing something, or chaos is erupting and you're just in the middle of it, and then all of a sudden you're like, oh, wait a minute, I'm feeling more agitated, like my heart's racing more, like I'm getting more, not irritated, but like stimulated by things, if that makes sense. And it's not as easy to calm down. And then you're like, wait, what's going on? Oh, they turned off. And then you just turn it back on. Just keep going.
Well, and I think what's nice about them is because they're just working in the background because you're in a situation where you really can't step away to try to
No.
calm down. You have to be calm in the moment. And so I love that's how the tappers are helping you.